can I ballot fluid from side to side? And if I put pressure on the distal margin of the radius or the proximal margin of the proximal row of carpal bones, for example, is there pain on palpation? I want to flex the carpus, asking the question, is there a normal range of motion? In a normal horse, I should be able to get the back of the fetlock to touch the caudal aspect of the antebrachium, as we see in the image on the right. In the image on the left, carpal flexion is restricted in association with osteoarthritis of the antebrachiocarpal and middle carpal joints. I want to systematically palpate the second, third, and fourth metacarpal bones from proximal to distal, asking myself, is there pain on palpation? And can I separate the second and fourth metacarpal bones from the suspensory ligament? I'm going to apply firm pressure over the proximal palmar aspect of the suspensory ligament from both the medial and lateral aspects, rolling away the overlying flexor tendons. Pain on palpation frequently will be a reflection of proximal suspensory ligament injury. However, the absence of pain certainly does not preclude significant injury. Bear in mind that the suspensory ligament at this level is effectively hidden with respect to be able to determine enlargement, although in association with acute injury, there may be distension of the medial palmar vein and perhaps subtle periligamentous edematous reaction. But this usually goes very, very quickly. Bear in mind that after strenuous exercise, there is often abnormal reactivity to palpation of the body of the suspensory ligament, which may persist for 24 hours after strenuous exercise. This is generally not a reflection of significant injury. I always want to say, is the response repeatable within a limb? And if it is repeatable, are there differences in the reactions between the left and right limbs? So I systematically palpate each of the suspensory ligament, the accessory ligament of the deep digital flexor tendon, the deep digital flexor tendon, and the superficial digital flexor tendon from proximal to distal. I'm palpating gently at first, asking the questions, are the margins well defined or rounded? Rounded usually reflects injury. Is the structure unusually soft, reflecting acute injury? Or is it firm, reflecting a previous injury? Is there pain on firm pressure applied to the margins of the structure, or pressure applied to the whole structure? Whilst doing this with the limb elevated, I'm always looking at the contralateral limb as well to determine whether or not there is normal posture of the fetlock of the weight-bearing limb. If there is abnormal extension, this may reflect dysfunction of either the suspensory apparatus or with severe injuries of the superficial digital flexor tendon. When assessing the response to flexion of the distal limb joints, I'm again asking, is there a normal range of motion as seen on the left, or is it restricted as seen on the right? Is there any pain on passive manipulation? Does the horse resent flexion?